Hi, everyone. We are back now at 7:16. So those temperatures, as Monica's been telling us all morning, they're starting to cool off. It's getting dark earlier, and people are spending less time outside.
And around this time, it can be very easy to forget about the damage the sun has had on our skin all summer. But doctors say now is the time that we should remember to check for those suspicious spots. And that's where we bring in Dr. Stephen Hess. He's the medical director from Center City Dermatology. Good morning, Dr. Hess, and thanks for coming on again.
My pleasure. Good morning.
Well, first, just tell us, why is now an important time to check our skin?
Well, it's an important time to check now because most of us have spent significant amount of time in the sun this summer. People have been to the beach, they've been doing outdoor activities. So I think the fall is actually an ideal time to get your skin checked, to look at your own spots, and to come in and get a skin exam by a dermatologist. This is the perfect time to do that.
Yeah, it makes a lot of sense, kind of like that seasonal change, and you get ready for the next season ahead. So what should we look out for?
So the most important thing to look out for is any spots that are new or changing. And by changing, I mean spots that are getting darker, spots that are getting larger, or any spot on your body that is itching or bleeding. Those are the most important things to look for.
And once we find those, we recognize those spots, what do you do next? What's the next course of action?
Well, so the most important thing to do if you see a spot that's new or changing is to see a dermatologist. That's important because that spot might be cancer or pre-cancer, so it's important to have that spot evaluated by a professional.
Good advice. And just because it's getting colder, if you're still spending some time out, doesn't mean that you cannot still get exposure from the sun. So you've got some tips actually to keep our skin safe. You want to go through those for us?
Sure, absolutely. The most important tip I can give you is to avoid getting excessive UV exposure. So that would be don't use tanning beds, and you want to avoid sunburns. And as you mentioned, you can still get sunburned even this time of year. Just because it's cooler out doesn't mean that those sun rays can't harm you. Another important point is to do skin self-examinations routinely, and I recommend to my patients doing them about every 3 months. As I said before, you want to look for newer changing spots, and especially spots that don't look like, if you have a spot that doesn't look like anything else on your body, well, sometimes we call this the outlier mole or the outlier spot. That's important to look at. And then family history is also important because if you have a family history of melanoma, that increases your risk. And then it is important to get an annual full skin exam, preferably by a dermatologist.
Yeah.
Mm-hmm. And Dr. Hess, are you starting to see more people come into your office now that the seasons have started to change to get checked out?
Absolutely. People definitely seem to come in for these skin checks in the fall. And another reason perhaps that is because when people are a little bit more tan after the summer, or during the summer, I should say, they tend to want to wait until their tan fades a little bit. So yes, this is probably the time of year we do our most skin exams for patients.
I like the idea of doing this too annually. We do so many other things, you know, on certain seasons, so it makes sense to also take care of your body the same way. I like the thinking. So where can people go to get more information, Dr. Hess?
Sure. Well, one place is the American Academy of Dermatology website. That's www.aad.org. And also there's information on our website at centercitydermatology.com.
Great.
Awesome. Thank you for the information. Thank you for coming on, and we definitely will take this into account and go get checked out.
Well, thank you so much. Have a great morning.
Thanks, Dr. Hess.